Hello, welcome to our evidence-based intervention presentation created by Cliff McManus, Erica Menchaca, Maren Miller, and Jody Nelson. Today we're going to review solution-focused therapy, also known as solution-focused brief therapy. Solution-focused therapy is used in a wide range of settings, most commonly in North America, Europe, and Asia. Solution-focused brief therapy really focuses on the strengths and the solution during session rather than problems. It should consist of short-term goal focus. It is an evidence-based approach that abides by positive psychology principles. Should always offer friendly hope. Again, constructing solutions rather than a great focus on the problem. Future-oriented. And your client really should leave session feeling pretty motivated. And that could depend on where they are in treatment. Certain populations that evidence has shown to really work, evidence has really shown that solution focused really works with is going to be child academics and behavior problems within the academic setting, even at home. Various adult mental health disorders, marriage counseling, couples counseling, and family counseling, health and aging populations or health and aging adults, crime and delinquency, and substance use disorders, kind of depending on where they are in their journey to health. In today's presentation, we're really going to focus on this intervention with groups and families. So a brief history on solution-focused brief therapy. In 1959, Don Jackson founded the Mental Research Institute in Palo Alto, California, which is still in operation today. The Mental Research Institution, on a side note, is really known for producing grants and finding innovative ways to provide therapeutic services. So just a few short years later, after the Mental Research Institution was founded, Paul Watzlawick, Robert Fish, and John Weakland founded what was then known as brief therapy. Their theory was the problem was interpersonal, so really between the people rather than within the person. And their approach was to identify what solutions weren't working and moving on to something else, so a different solution. So fast forward to the 1970s, a lovely couple, Steve DeShazer and Inzu Kim Berg, who lived in Milwaukee, Wisconsin, and owned the Family Brief Therapy Center. They really took a liking to the brief therapy intervention, and they started teaching it to their associates, and it just became embedded in their culture. And so then they kind of just put their heads together and found ways to expand on brief therapy. And their three major contributions to brief therapy, transitioning it into solution-focused brief therapy, was it is important to elicit questions from the client. So a good example is, what would you like instead, or what would be better? And then questions about details. So once they kind of give you the idea in their head of what would be better, kind of ask questions like, what's helped in the past, or what's been successful in the past. That kind of puts them in, the frame of mind of, oh, I've done it before. And then verbal rewards. So when they disclose previous successes in, finding solutions to their problems, say things like, oh, how did you do that? Or tell me more about that. What was successful about it? Because that kind of just instills more motivation into them. And then Mr. Milton Erickson, he also contributed to the expansion of brief therapy. by stating that it is important to get the perceived goal of the client. Make sure that you have a good gauge on the competence of the client, and try and seek any possibilities for action or change revealed by the client. And that is, in a nutshell, how solution-focused brief therapy has become what it is today.
Now that we've discussed the history of this modality, let's look at how the process is conducted. So in this treatment, it's incredibly important that the client is empowered as the expert of their own experiences. Collaboration is key, and so treatment goals are co-constructed. The focus in this modality is on solutions versus problems. Sometimes it can be difficult to pinpoint goals, so there are some great techniques that we as practitioners can use. According to Corey 2005, clients tend to present only one side of the problem, and solution-focused therapists invite clients to view their problems from a different side. So the miracle question is a great way of doing this, as it helps formulate future-focused vision that helps identify goals and possible solutions. The question can take many forms and can be laid out like this. I'm going to ask you a bit of a different question. Imagine for a moment that you go to sleep, and while you're sleeping, a miracle occurs and solves the problem that brought you into session today. When you woke up, how would your life be different? How would you know that your miracle has occurred? What does the miracle look like, and who contributed to it? Client answers can also be written or drawn as a picture. These activities can actually engage clients more. So a child in our family system may draw an answer like the picture on the right. Maybe the child that draws a picture then discovers that her miracle includes more time with her mom outside. So let's move on to exception finding questions. These questions help clients identify times when they have not been defeated by their problems. Example questions include, can you tell me about a time when things were better? Then you can build on the question and ask things like, so what were you doing differently then? This helps the clients to identify their strengths. These questions revisit past successes that clients can use to accomplish current goals. So now scaling questions can create solid baselines of where the client is currently at. Scaling questions can also gauge progress, and they can help break goals up into small steps. Here's an example of a scaling question. Let's say our client wants to work on worrying. I may ask, on a scale from 1 to 10, 1 being the most worried you've ever been, and 10 being absent of all worries, what number would you rate yourself today? Let's say the client answered between a 5 and a 6. I would then say, what would need to happen or what would need to change so that you could say things were between a 6 and a 7? This helps clients get specific about what they would like to change and do differently. Another technique includes coping questions. These questions are focused on hopefulness. This is where we get to empathetically ask, how have you been managing difficult circumstances? How have you been managing these difficult circumstances all along? This technique highlights what they have been doing that works. Identifying what works can increase confidence. I may ask, what are you doing now that is working? When looking at compliments, Frank 2016 says compliments encourage clients and increase their efficacy as they work on meeting their goals. End of session compliments and feedback are vital to successful treatment. So now let's take a look at the next slide. So the recommended length of treatment is typically 5 to 8 sessions. 8 sessions would be the maximum since this is a short-term treatment. Despite the variability of this practice, attempts have been made to specify the core components of this therapy to increase treatment fidelity. To increase fidelity, therapists must maintain focus on what the clients want their goals to be, their strengths, and their current resources. So how do we know if it's all working? Homework assignments are a great method to use in this modality because they encourage clients to take steps toward their goals in their daily lives. We can see if the therapy is working through the completion of homework and the completion of the steps towards their ultimate goal. Rating scales are great for measuring too, as I mentioned earlier, because we're able to see if their current goals are improving their presenting problem. So now let's discuss some strengths and weaknesses of this modality.
Probably one of the most obvious, but also most powerful strengths of solutions-focused therapy is how empowering it is for a client or for a family or group. The whole idea is to focus on the fact that the client or family has everything that they need to be able to solve their problems already, that there is no problem that they can't solve, and that change is constant, but that they will ultimately be able to succeed because of the strengths that they already have. Another big strength is that it has been shown to work, that there is improved behavior and improved family relations that have been studied. Things like teens being able to manage their schoolwork better, or being able to manage their anxiety better, or being able to work better with their parents and having better communication with their parents are all results of this treatment that has been documented, and that these results and these improvements are still in place at a 6-month follow-up, that they are still consistent. Another strength is that this therapy is a short-term therapy, that it does not take very long for the family or the individual to be taught these skills to be able to solve their own problems and to not need a therapist anymore. For weaknesses, there just are some situations that this type of therapy might not be as appropriate as other times, certain situations. One specifically is that in a relationship where domestic violence is present, this kind of therapy does not allow for blame. And so the individual who is perpetrating the violence has a lower level of responsibility than they should have. And the person who is surviving or the victim of the violence has a higher level of responsibility than they should have. The victim is blamed, and the perpetrator does not have to take as much responsibility, which creates an unequal ground, an unequal footing for the couple or the family as they try to move forward in therapy. Another situation that this might not be as appropriate is if there are outside influences that need to be addressed. And there is just no space for that in solutions-focused therapy, that if there is trauma or there are emotions that need to be processed before progress can be made, that this is not the kind of therapy that works for that. Solutions-focused therapy doesn't take into account that there might be a power differential between men and women in the group or an individual and their support systems. It might make a lot of assumptions about roles, stereotypical roles that might be happening in the group or the family, and that just this therapy is not the place for those issues to be addressed. Another weakness could be that this therapy is short-term. It just might not be able to provide the kind of support that some people in some situations might need, and that's something that needs to be considered when considering this kind of a therapy. For some cultural adaptations that have been applied for this kind of therapy, there was a study done for individuals who have learning disabilities using solutions-focused therapy. Usually with solutions-focused therapy, there are a lot of different techniques to encourage the client or the group, the family, to come up with their solutions, to identify their strengths, but that isn't as effective with someone who has a learning disability. All of those techniques can become overwhelming and disjointed in their thought process. So using a single technique is much more effective for them. These individuals, just because of the nature of their disability, might need more support post-termination of therapy. They might need to contact their therapist more to kind of review skills that they have learned, or they might need to rely a little more on their support circles to be able to process questions and problems that they have to be able to find those solutions, just because the nature of their disability doesn't allow them to make those concrete connections in their mind like it would for someone else. For American Indian cultures, that there are a lot of cultures in that community where honoring humility and refraining from boasting is a really big part of their culture. So solutions-focused therapy can be a little bit difficult to implement because focusing on strengths of an individual or a group of family can be very uncomfortable for some people in this culture. So sometimes the strengths have to be phrased in a different perspective, that they have a strong spiritual belief, or that they have good family connections, and not something that they are able to boast about or be proud about. And similar with their success or rewards, verbal rewards, or looking back in the past to see how they have handled things in the past. Usually a therapist will use a paraphrasing technique to connect and to show that they're listening and encourage that dialogue. But with a lot of cultures with American Indians, it's important to ask the client or the group to state their success, and then for the therapist to restate exactly how the individual or the group has stated it, to avoid those feelings of discomfort and pridefulness and boastfulness. Miracle questions also should be focused on present time orientation rather than a miracle that happens in the future, just because of the way that a lot of cultures within this community view the present moment versus the future moment.
So we would recommend the solution-focused brief therapy with families in a variety of settings and with diverse problems or concerns. This list isn't extensive, but it does show that the variety of ages, no matter who the client is or who the whole family support system, it could benefit from the solution focus with various problems as indicated here, and that we've talked about too just before getting to this portion of the presentation. One example, Maren talked about when it wouldn't be very good for a domestic violence situation, but there is a time when the solution focused therapy would be good for domestic violence offender treatment. And that is when the focus is not on the domestic violence and focusing on the problem and more on the offender finding solutions. And we can see in a study that compares the solution focus to traditional treatment approaches. And if we click on to move it forward to the next animation, we'll be able to see the recidivism rates be very different. So with the solution focus, and maybe if Cliff could hit that button to move it forward, we can see that at the 16.7 recidivism rate and a completion rate of 92.9% with the solution focus compared to traditional treatment approaches. It shows a significant difference. This recidivism rate with the traditional approaches are 40 to 60%, and the completion of these types of programs are less than 50%. And because of this high success rate with the solution focus, we would also recommend, just because of this and in other situations, and we can move to the next slide, for group settings, the group members can support each other, and they can keep the group from dwelling on problems and focus on the solutions. In a crisis intervention situation, the time really doesn't allow for the focus to elaborate on the diagnosis. So it's just the immediate solutions, focusing on the positive rather than the negative behaviors is something the solution focus do, and it spotlights the solutions. Because of the high completion rate, getting through the program, there is a low recidivism rate too than other therapies. So this is a positive thing for the solution focus and why we would recommend it. Solution focus is brief, so waiting lists can be reduced. Many families are waiting to get into therapy for their loved one situations or for the whole family to be treated, and it is cost efficient. One area that we would exercise caution, or when it's not recommended, is when there is a situation where it is impossible to establish a dialogue with the client. And solution focused brief therapy appears to be particularly effective when there is an early intervention, but when there's presenting problems that are severe and intense, this may lend itself to either have a combined approach or a lengthier form of psychotherapy that might be needed. One final reason that we would recommend the solution-focused brief therapy is explained well in the following statement by Bannock. The left hemisphere of the brain is occupied with logical analysis and language-based communication. But working in a solution-focused manner with a high utilization of imagination, such as mental rehearsal, hypothetical questions, stimulates the nonverbal and the holistic capacities of the right hemisphere. This success of a solution-focused therapy might be partially explained in the way that it addresses both hemispheres of the brain. So in summary, for families, the solution-focused approach allows for opportunities for each other to see each other's point of view and the level of problem, how they view that, what their hopes are for the life to look without the problem, and their ideas for creating the solutions that are completely applicable to them in their family culture. This strengthens the buy-in for the solutions that have been gathered and has the biochemistry piece as the brain is reorganizing the story with the memories, the emotions, and ultimately the perception can switch, which allows for a stronger investment in the solutions. The solutionfocus.net is a website that is a great resource to learn and become more proficient in developing skills and techniques in the solution focus. It has articles and trainings as well. So as practitioners, as a final comment here, when practicing solution focused therapy, we are leading and guiding from a space, providing a space and a framework for families to lead themselves through the process of finding the solutions. So thank you. And here's our references.